everyone. How you guys doing? Joshua Payton, graduate student, part of the UNC MPS program. I'm part of this amazing class called GRAD 760. Shout out to these two professors. I get a chance to share a little bit about my final project. It's on predicting disease before it happens, AI and preventative healthcare. Amazing. And I'm going to jump right into it. So just imagine going to the doctor, right? And being told not just what you have, but what you're likely to develop in the next 5 years. And then how to prevent it, right? And that's exactly what artificial intelligence is starting to do in healthcare today. So traditionally, healthcare has been reactive. We treat diseases after symptoms appear, but AI is changing that by making healthcare more predictive and preventative. And instead of asking, what does this patient have? We can now ask, what is this patient at risk for, and how can we stop it early? So AI uses machine learning models that are trained on large data sets such as electronic health records, genetic data, and even lab results, and also environmental and social factors. These models learn patterns and relationships between variables that are often too complex for humans to detect. So, for example, AI might recognize that a combination of slightly elevated blood pressure, sleep patterns, and even family history increases the probability of heart disease, even in, if each factor alone seems normal. And once trained, the model can analyze new patient data and generate a risk prediction score. And this can help clinicians make earlier and more informed decisions. So in real world applications, AI is already being used to predict cardiovascular disease risk years in advance. And, we can detect early biomarkers of Alzheimer's disease through imaging and protein analysis, and even identify patients at risk for adverse drug reactions based on genetics and prior responses. And guys, this goes beyond a simple diagnosis. It's about understanding, the risk at a deeper and more personalized level. And this matters because early prediction leads to early intervention. Patients can make lifestyle changes, receive preventative treatments, or even be more monitored more closely before the disease progresses. And this also reduces healthcare costs by avoiding expensive late-stage treatments and hospitalizations. In addition, AI supports personalized medicine, where treatment and prevention strategies are tailored specifically to each individual. And organizations like the NIH and FDA are actively exploring how AI can improve clinical trials, patient safety, and regulatory decision making. And this is important, especially important, for addressing health disparities, where early risk detection can improve outcomes in underserved populations. So, the future of healthcare isn't just about treating illness, right? It's about predicting and preventing it. And AI is the tool that's making that future possible. Thank you.